Welcome to episode 8 of Ask the Fascia Masters. My name is Deanna Hansen. I'm the founder of Fluid Isometrics and Block Therapy. I can't tell you how much I appreciate the questions that come toward us so that we can answer your questions, learn more from you, and then make that really great connection so that we can support you best as you go through your fascia decompression journey. Some of the things we're going to be covering in this episode are the benefits of blocking with ankylosing spondylitis, what happens if you have created so much pain in your body that you're unable to do activity. Will block therapy help, and what are the possible repercussions of that? And also, people are always asking questions about instructors and body workers in your area. So we address this as well as so much more on this episode. If questions come up as you watch, leave them in the comments below so we can be sure to answer them in the next episode. One of the most common questions we see on our channel is, what is blocking? Block therapy is a self-care fascia-based modality where we use our tool, the Block Buddy. We also have additional tools, a Block Baby and a Block Paddle, to get into the layers of fascia to melt the adhesions that are blocking blood and oxygen flow. There's 3 pillars to block therapy. The first one is creating space, putting the space back into the body that time has taken away. Essentially, as we get older, we get shorter and wider, and this creates issues with optimal blood flow as well as lymphatic drainage. So we create the space in the body that we've lost through time. Then also through the understanding of proper diaphragmatic breathing, we send blood and oxygen into these newly created spaces so we can awaken the cells previously blocked. And then the third pillar is understanding proper postural foundations. We have systems in our body to support proper cell alignment. However, if we don't apply those, we start collapsing under the force of gravity and unconscious living. Understanding these pillars and applying fascia decompression to your body allows you to age in a different way than if you're unconscious of posture and breath. And this leads us into our next question. Can we use yoga blocks for this therapy? And I get this question all the time. The reason that we use the tool that we have, this is made of wood, and bone and wood are similar in density. And because we are melting through layers of fascia to get to the root of the issue at the bone, we need something similar in density to bone to be able to activate the body in that depth. So using a yoga block isn't negative, but it's not going to go as deeply as the Block Buddy. And honestly, the rolled up towel will give you a denser medium to activate your body properly in order to really understand this modality. A lot of people reach out to block therapy because they have scoliosis and ask if we have a series specifically for this. We don't actually have a specific series for scoliosis because it's a very individualized program that one of our assessors will create for you. When we're looking at scoliosis, there's so many cause sites that need to be addressed. The limbs, the head. The limbs actually create what's going on in the core of the body. So to be able to read the body properly and then provide the proper prescription for classes for you to do, that's the best approach so that you can get to the root of the issue and really correct what's going on in your body. If you're interested in having an assessment with one of our therapists, on our website, you can go to the shop page and you'll find assessments. A 61-year-old gentleman mentioned that years ago he had to stop any activity because of back pain. And then 6 weeks after starting block therapy, he ended up having a number of rib releases in the lower thoracic area, which actually caused him quite debilitating muscle spasms for about 5 days. I just want to share, this is a common thing, especially when we've had so much restriction in the body over our lifetime, and especially for people that are really active because of doing weights or other activities. We're really binding and winding our body very aggressively over time. So when we start this process of block therapy, what we're doing is we're repatterning the body so that we can bring the cells back to correct alignment and support proper postural foundation. But this is a journey. So especially if you've had debilitating issues from the past, this is a common scenario that can happen. If it does, you can always reach out to support@blocktherapy.com for guidance and assistance. Also, our Facebook community group, Block Therapy Community, it's incredible. We have so much support in there. So if anybody's ever concerned about anything, please reach out so we can address this properly for you. Melissa asked 2 questions. The first one is about blocking for emotional trauma around the heart. When we have, whether it's physical, emotional, mental trauma, the reaction of the body is to hold the breath. This is because this vulnerable area, we pull it in for protection. If you've ever seen a deer survive an attack, on the other side of it, the deer shakes because they're releasing that negative energy from the body so they can bring their nervous system back to neutral. Now, we as humans, we tend to go into that freeze mold and then we stay there. Then we're aging from that perspective, and it creates a ton of density and it traps that emotion in the layers of fascia. So as you're doing this work, what we're doing is we're getting into those layers, and with that exhale, we're bringing the emotion up so that we can release it and bring the body back into neutral so your nervous system gets reset. We want to be in parasympathetic about 80% of our day. That's where we heal. Most people, though, are in sympathetic because of that response of pain and trauma over our lifetime. So this program will absolutely benefit you, and you may experience a lot of emotional releases, crying, anger, whatever those locked emotions are, they will come out with this practice. Melissa also asked a question about knee tracking and if block therapy will benefit this. And absolutely. What's going on with knee tracking is the patella should be gliding up and down in a groove. However, when our feet start pulling us out of alignment, that affects the alignment of the knee. And then the tracking of the patella becomes compromised and can actually create a wearing of the cartilage between the patella and the knee joint. So bringing your body back into proper alignment is the key to bring the knees back so that they can track properly. A question was asked, is there any way to assist with ankylosing spondylitis? And yes, there is. What we need to understand is the alignment of the feet and the ankles are major cause sites for what's going on up the chain. If you look at the foot, the tibia should be positioned on the heel so that we can dorsiflex properly when we're stepping. Yet for people with ankylosing spondylitis, if you look at the foot, you'll notice that the tibia has migrated, which affects our ability to dorsiflex. So then we end up walking with a twist. This twisting is what is pulling the body into the system and affecting the vertebrae. So to correct the body from the foundation is key to address ankylosing spondylitis. Someone asked if there's anything we can do for an uneven jaw where one side is looser. I've shared a video, a tongue decompression technique that is absolutely fantastic at bringing symmetry, balance, and resetting the jaw. We're going to put the link below so that you can do this. I would recommend doing this daily or every other day to really experience the benefits. We've been seeing so many people reach out with the success that they're having with this technique. Someone asked, where's block therapy been all my life? I love that question. So I started developing this whole protocol back in 2000, but it wasn't until about 2010 when block therapy came into existence. And then this was a new concept. So it took a little bit of time to really gain traction. When COVID hit, that really brought block therapy more to the forefront. And then in the last 2 years, we've seen incredible growth. So it's not that you've missed it, it's just that it's a new process, a new technique, and we're now gaining massive traction worldwide. So you're going to be seeing a lot more about this. We're often asked the question, is there an instructor or body worker in my area? On our website, we have a teacher finder map under our About page. You can go there to see if you do have an instructor in your area. But the reality is, we're still fairly new and we need more people. Our Block Therapy Academy has 3 parts to it. One is to teach block therapy, one is for body workers to learn the fluid isometrics technique, and the other is for estheticians so that they can perform natural facelifts to their clients. As we continue to grow, we will keep updating that teacher finder map, and hopefully you can find someone close by. A mom mentioned that her daughter was born with a curled toe, and is there anything that she can do? And absolutely there is. One thing I want to share is in my membership, I have a Block for Kids section. In there, I have a video, fascia decompression for the toddler. That's where you as the mom is doing the work on your child. So this is a really good first step to address full body alignment, because the curled toe, it's not just coming from the toe, it's really coming from the full body patterning, the calves in particular. Another thing that you can do to add to this though, is the work between the toes, taking your finger or a pencil and pressing down between each toe for 3 minutes And then I'm not sure how old the child is now, but if they can focus on full exhalation during this, you're really going to be optimizing the benefits. So either way, there's definitely things that you can do. And if you need more from us, please reach out to support@blocktherapy.com so we can assist you. That wraps up episode 8 of Ask the Fascia Masters. Thank you so much for taking the time, and we look forward to hearing more from you in the future.